Female reproduction. Infertility is defined as trying to get pregnant, having sex regularly, for at least a year without success. Female infertility, male infertility, or a combination of these affects millions of couples in the United States. About 10 to 18% of couples have a difficult pregnancy or childbirth. Infertility is caused by the female characteristics of about 1/3 of the time and male characteristics by about 1/3 of the time. The cause is unknown or a combination of male and female characteristics in the remaining cases. The causes of female infertility can be difficult to diagnose. There are many treatments available, depending on the cause of the infertility. Many infertile couples will continue to become pregnant without treatment. After trying for 2 years to conceive, about 95% of couples successfully conceive. Symptoms. The main symptom of infertility is infertility. The menstrual cycle is very long, 35 days or more, very short, less than 21 days, and rare or absent can mean you are not mature. There may be no other signs or external signs. When to see a doctor when you need help. Sometimes it depends on your age. Up to the age of 35, most doctors recommend trying to get pregnant for at least a year before testing or treatment. If you are between 35 and 40, discuss your problems with your doctor after 6 months of testing. If you are over 40, your doctor may want to start testing or treatment immediately. Your doctor may also want to start testing or treatment right away if you or your partner has known birth defects, or if you have a history of abnormal or painful periods, pelvic inflammatory disease, recurrent pregnancy, previous cancer treatment, or endometriosis. Causes for each of these things. It is important to get pregnant. You need to open the eggs. During pregnancy, your ovaries must produce and release an egg, a process known as ovulation. Your doctor can help you monitor your menstrual cycles and ensure egg production. Your partner needs sperm. For many couples, this is not a problem unless your partner has a history of illness or surgery. Your doctor may perform simple tests to check your partner's sperm health. You need to have sex regularly. You need to have sex regularly during your fertile period. Your doctor can help you better understand if you are overweight. You need to have open fallopian tubes and a normal uterus. The egg and sperm meet in the thighs, and the fetus needs a healthy uterus to grow. For pregnancy to occur, all steps of the human reproductive process must be properly performed. The steps in this process are: one of the 2 eggs lays a mature egg. The egg is picked up by the fallopian tube. The sperm swim out of the cervix, through the uterus into the fallopian tube to reach the egg to grow. A fertilized egg travels down the fallopian tubes into the uterus. The implantation of a fertilized egg has grown in the uterus. For women, many things can interfere with this process at any time. Female infertility is caused by one or more of the following factors. Maturity problems. Disruption of ovulation, which means whether you are overweight or not, causes infertility in about 1 in 4 infertile couples. Problems with the control of reproductive hormones by the hypothalamus or pituitary gland, or problems in the ovary, can cause ovulation disorders. Polycystic ovary syndrome, PCOS. PCOS causes hormonal imbalances, which affect ovulation. PCOS is associated with insulin resistance and obesity, abnormal hair growth on the face or body, and manure. It is a common cause of female fertility. Hypothalamic dysfunction. 2 hormones produced by the pituitary gland are responsible for ovulation each month: follicle-stimulating hormone, FSH, and luteinizing hormone, LH. Excessive physical or emotional stress, very high or very low weight, or recent weight gain or disruption can disrupt the production of these hormones and affect egg production. Rare or absent times are the most common symptoms. Premature ovarian failure. Also called primary ovarian dysfunction, the disease is usually caused by an autoimmune response or premature loss of eggs from your uterus, either from genetics or chemotherapy. The ovary no longer produces eggs, and it reduces estrogen production in women under 40. Too much prolactin. The pituitary gland can cause excessive production of prolactin, hyperprolactinemia, which lowers estrogen production and can also cause fertility. It is usually related to the problem of the pituitary gland, which can be caused by medication. Injuries to the fallopian tubes. Infertility. Injured or blocked fallopian tubes prevent sperm from reaching the egg or preventing the passage of a fertilized egg into the uterus. Causes of tube damage or blockage may include inflammation, infection of the uterus and tubes due to chlamydia, gonorrhea or other sexually transmitted diseases, previous surgery on the abdomen or pelvis, including the provision of an ectopic pregnancy, in which a fertilized egg is implanted and grows in the uterine tube instead of the uterus. Pelvic tuberculosis, the leading cause of intestinal obstruction worldwide. Although rare in the United States, endometriosis occurs when tissues that normally grow in the uterine organs and grow elsewhere. This extra tissue growth, and surgical removal, can create a scar, which can block the fallopian tubes and keep the egg and sperm from mixing. Endometriosis can also affect the lining of the uterus, disrupting the implantation of a fertilized egg. This condition also appears to affect fertility in indirect ways, such as sperm injury or ovulation. Causes of uterine or cervical cancer. Several causes of uterine or cervical cancer can affect fertility by disrupting implantation or increasing the risk of miscarriage. Benign polyps or tissues, fibroids or myomas, are common in the uterus. Others can block the fallopian tubes or interfere with implantation, which has affected fertility. However, many women with fibroids or polyps become pregnant. Endometriosis or inflammation of the uterus can interfere with implantation. Abnormalities of the uterus that occur from birth, such as abnormally shaped uterus, can cause complications of pregnancy or miscarriage. Cervical stenosis, a narrowing of the cervix, can be caused by malformations or damage to the cervix. Sometimes the cervix cannot produce the best type of mucus to allow sperm to travel through the cervix to the uterus. Unexplained infertility. Sometimes, the cause of infertility is not found. The combination of a few small things in both partners can cause unexplained reproductive problems. Although it is frustrating not to get a specific answer, this problem can be corrected in time. However, you should not delay birth control. More details. Fallopian tubes. Can pregnancy occur with only one? Hypothyroidism and infertility. Any communication? Risk factors. Certain factors may place you at greater risk for infertility, including age. The quality and quantity of a woman's eggs begins to decline with age. By the mid-30s, the rate of string loss is slowing down, resulting in smaller eggs and poorer quality. This makes pregnancy more difficult, and increases the risk of miscarriage. Smoking. In addition to damaging your cervix and fallopian tubes, smoking increases the risk of miscarriage and ectopic pregnancy. It is also thought of creating your ovaries and laying your eggs prematurely. Stop smoking before starting fertility treatment. Weight. Obesity or obesity can affect normal ovulation. Getting to a healthy body mass index, BMI, can increase the frequency of ovulation and the chance of pregnancy. Sexual history. Sexually transmitted diseases such as chlamydia and gonorrhea can damage the fallopian tubes. Having unprotected sex with multiple partners increases the risk of sexually transmitted infections that can lead to later reproductive problems. Alcohol. Stick to drinking no more than 1 alcohol per day. Prevention. For women contemplating pregnancy sooner or later, the following tips can help increase fertility. Maintain a normal weight. Obese and overweight women are at greater risk for ovulation disorders. If you need to lose weight, exercise moderately. Severe, intense exercise for more than 5 hours a week is associated with decreased ovulation. Stop smoking. Tobacco has many negative effects on fertility, not to mention your general health and fetal health. If you smoke and are thinking of getting pregnant, stop it now. Avoid alcohol. Excessive drinking can lead to reduced fertility. And any use of alcohol can affect the health of the developing fetus. If you are planning to become pregnant, avoid alcohol, and do not drink alcohol during pregnancy. Reduce stress. Some studies have shown that couples who suffer from depression have lower effects on fertility treatment. If you can, find a way to reduce stress in your life before you try to get pregnant. Reduce caffeine. Studies suggest that limiting caffeine intake to less than 200 milligrams a day should not affect your ability to conceive. That's about 1 to 2 cups of 6 to 8 ounces of coffee a day. Diagnosis: if you have failed to conceive at the right time, seek help from your doctor to diagnose and treat infertility. Fertility tests may include ovulation test. Home, over-the-counter ovulation kit predicts luteinizing hormone, LH, explosion that occurs before ovulation. Blood tests for progesterone, a hormone produced after ovulation, can also record ovulating. Other hormone levels, such as prolactin, can also be tested. Hysterosalpingography. During hysterosalpingography, hysterosalpingography, an X-ray difference is implanted in your uterus and an X-ray is taken to detect abnormalities in the uterine cavity. The test also determines if fluid is released from the uterus and spills out of your fallopian tubes. If an abnormal diagnosis is made, you will need additional testing. For a few women, the test alone can improve fertility, perhaps by removing and opening the fallopian tubes. Ovarian reservation test. These tests help determine the quality and quantity of eggs available for ovulation. Women who are at risk for a complete egg donation, including women over the age of 35, may have this series of blood and psychiatric tests. Another hormonal test. Another hormone test checks the levels of ovulatory hormones as well as thyroid and pituitary hormones that regulate reproductive processes. Testing test. A pelvic ultrasound looks at the uterine or fallopian tube. Sometimes a sonohysterogram, also called a saline infusion sonogram, is used to detect details inside the uterus that are not visible on a standard ultrasound. Depending on your situation, rarely do your tests include another imaging test. Depending on your symptoms, your doctor may ask your hysteroscopy to look for uterine or fallopian tube disease. Laparoscopy. This minimally invasive surgery involves small cuts under your navel and inserts a small viewing tool to examine your tubes, eggs and uterus. Laparoscopy can identify endometriosis, scar, obstruction or abnormalities in the fallopian tubes, and problems with the ovaries and uterus. Genetic testing. Genetic testing helps to determine if there is a genetic defect that causes infertility. Treatment. Infertility treatment depends on the cause, your age, how long you are infertile and your liking. Because infertility is a complex problem, treatment involves greater financial, physical, mental, and temporal commitment. Although some women need 1 or 2 treatments to restore fertility, a variety of treatments may be needed. Treatment may try to restore fertility through medication or surgery, or help you get pregnant with advanced techniques. Reproduction. Promoting ovulation with birth control drugs. Reproductive drugs control or stimulate egg maturation. Birth control pills are the main treatment option for infertile women due to the disruption of ovulation. Fertility drugs usually act as natural hormones, follicle-stimulating hormone, FSH, and luteinizing hormone, LH, to initiate ovulation. They are also used in aging women to try to promote a better egg or extra egg or eggs. Birth control drugs can include clomiphene citrate. Clomiphene citrate is taken orally and stimulates egg maturation by causing the pituitary gland to release more FSH and LH, which promotes the growth of the ovarian ovaries. Gonadotropins. Instead of stimulating the thyroid gland to produce more hormones, these injected mechanisms stimulate the ovary directly to produce more eggs. Gonadotropin medications include human menopausal gonadotropin or HMG, Menopur, and FSH, Gonal F, Follistim AQ, Brevel. Another gonadotropin, chorionic gonadotropin, Ovidrel, Pregnal, is used to fertilize eggs and cause them to be released during ovulation. There is concern that there is a high risk of recurrence and early delivery with gonadotropin use. Metformin. Metformin is used when insulin resistance is a known or suspected cause of infertility, usually in women with PCOS. Metformin helps to improve insulin resistance, which can improve the chances of ovulation. Letrozole. Letrozole, Femara, belongs to a class of drugs known as aromatase inhibitors and works in a similar way to clomiphene. Letrozole can cause ovulation. However, the effect this drug has on early pregnancy is still unknown, so it is not used for ovulation as often as others. Bromocriptine. Bromocriptine, cyclozet, a dopamine agonist, can be used when ovulation problems are caused by excessive production of prolactin, hyperprolactinemia, by the pituitary gland. Risks of birth control pills. Contraceptive use has certain risks, such as repeated pregnancies. Oral medications have a much lower risk of recurrence, less than 10%, and especially the risk of twins. Your chances of getting up to 30% with injectable drugs. Injectable drugs have a higher risk of 3 or more pregnancies, multiple consecutive pregnancies. Often, the more children you have, the greater the risk of premature labor, low birth weight and later developmental problems. Sometimes adjusting the medication may reduce the risk of recurrence, if too many strings appear. Ovarian hyperstimulation syndrome, OHSS. Injecting birth control pills can cause OHSS, which causes swollen and painful eggs. Symptoms and signs often disappear without treatment, and include abdominal pain, constipation, nausea, vomiting, and diarrhea. If you become pregnant, however, your symptoms may last for a few weeks. In general, you may have developed a more severe form of OHSS that can cause rapid weight gain, enlarged ovaries, fluid in the abdomen and shortness of breath. Long-term risks of ovarian tumors. Numerous studies of women who use birth control pills show that there are fewer if any long-term risks. However, some studies show that women who take birth control pills for 12 months or more without a successful pregnancy may be at greater risk for ovarian linear tissue later in life. Women who have never been pregnant have an increased risk of ovarian cancer, so it may be related to a more basic problem than treatment. Since success rates are often high within a few treatment cycles, re-evaluating drug use every few months and focusing on the most effective treatment seems appropriate. Fertilization. Surgery. Many surgical procedures can correct problems or otherwise improve the fertility of women. However, fertility treatments are less common these days because of the effectiveness of alternative therapies. Includes laparoscopic or hysteroscopic surgery. This surgery can remove or correct abnormalities to help improve your chances of getting pregnant. Surgery can include correcting abnormal uterine conditions, removing endometrial polyps and other types of fibroids that badly form the uterine cavity, or removing pelvic or uterine adhesions. Tubal surgery. If your fallopian tubes are blocked or filled with fluid, hydrosalpinx, your doctor may recommend laparoscopic surgery to remove the attachment, enlarge the tube or create a new bowel opening. This surgery is rare, as pregnancy rates are usually better with IVF. With hydrosalpinx, removal of your tubes, salpingectomy, or blocking the tubes near the uterus can improve your chances of getting pregnant with IVF. Reproductive aid. The most commonly used birth control methods include intrauterine input, IUI. During IUI, millions of healthy sperm are inserted into the uterus near the time of ovulation. Assisted reproductive technology. This involves returning the mature eggs to the female, implanting them with sperm in a laboratory, and transferring embryos into the uterus after conception. IVF is a very effective reproductive technology. The IVF cycle lasts a few weeks and requires regular blood tests and daily injections. Dealing with the infertility of women can be physically and emotionally devastating. To cope with the ups and downs of childbirth testing and treatment, consider the following strategies. Be prepared. Uncertainty of birth control and treatment can be difficult and stressful. Ask your doctor to explain your treatment steps to help you and your partner prepare. Understanding the process can help reduce your anxiety. Seek support. Although infertility can be a personal problem, reach out to your partner, close family members or friends, or a specialist for support. Many online support groups allow you to maintain your anonymity while discussing issues related to infertility. Exercise and eat a healthy diet. Maintaining a regular exercise routine and eating a healthy diet can improve your mood and keep you focused on your health despite having birth defects. Consider some options. Decide on alternatives: adoption, donating sperm or egg, or even infertility, early in the birth process. This can reduce anxiety during treatment and depression if pregnancy does not occur. Preparing for your appointment for a birth test, you will probably see an endocrinologist, a doctor who specializes in treating disorders that prevent couples from getting pregnant. Your doctor will want to check you and your partner to find the causes and treatment for birth defects. What you can do preparing for your appointment. Chart your menstrual cycles and associated symptoms for a few months. On a calendar or electronic device, record when your period starts and stop and what your uterine contractions look like. Write down the days when you and your partner have sex. Make a list of medications, vitamins, herbs or other ingredients you take. Enter dosages and how often. Submit previous medical records. Your doctor will want to know what tests you have taken and what treatments you have already tried. Carry a notebook or electronic device. You can find a lot of details when you visit, and it can be hard to remember everything. Think about the questions you will ask. Write down the most important questions first to make sure they are answered. Some basic questions to ask include: when and how often should we have sex if we hope to get pregnant? Is there a lifestyle change we can make to improve the chances of getting pregnant? Do you recommend any tests? If so, what kind? Are there any medications that can improve the ability to conceive? What side effects can medication cause? Can you elaborate on our treatment options? What is the best treatment for our condition? What is your success rate in helping couples achieve pregnancy? Do you have any brochures or other printed material that we can have? Which websites do you recommend visiting? Do not hesitate to ask your doctor to repeat the details or ask the following questions. What to expect from your doctor. Other questions your doctor or other healthcare provider might ask include: how long have you been trying to get pregnant? How often do you sleep? Have you ever been pregnant? If so, what was the outcome of that pregnancy? Have you had orthopedic or abdominal surgery? Have you ever been treated for any of the conditions for women? When did you start menstruating? At what age? On average, how many days pass between the beginning of one menstrual cycle and the beginning of your next menstrual cycle? Do you experience premenstrual symptoms, such as tenderness, bloating, or bloating?